Hey guys, this is Dr. Abul Mali with North Atlanta Plastic Surgery Group. So today I'm gonna talk about drain management. It's common after a lot of surgical, including cosmetic and reconstructive procedures, to have surgical drains. What is a drain? It's basically a plastic bulb connected to a tube which comes out of the body. And what it does, it collects all the fluid and secretions from inside the body at the site of surgery and collects inside this plastic bulb. It's a very simple mechanical suction. So as you can see, this bulb is always squeezed uh, as compared to being open. When it's squeezed, it produces a suction that sucks all the fluid out. And it's very important basically to empty this drain twice daily and chart out how much fluid comes out each day. Based on the amount of fluid coming out, your surgeon will decide when to remove the drain. Emptying the drain is very simple. As you can see here, there is a cap on top. So you open the cap, you empty it in a plastic cup, and basically after emptying it, you measure how much is putting out and then squeeze it and put the cap on. As you can see, it always needs to be squeezed. This produces the mechanical suction. Other questions about the drain is about the color. The color of the output can vary from red to clear to white, or to a little bit darker, even black color. Normally you should not worry about the color of fluid coming out. It's depending on the timing after the surgery, the color changes normally from a bloody color to more clear color, but sometimes if there is some hematoma or something, it can be darker color, or if there are some other products used, it might be even white or looking like pus. As long as you don't have symptoms of infection, let's say fever, chills, I say don't worry about the color of the fluid coming out. And also regarding the amount, one day you may have less output and next day doubles the output. As long as it's not pure blood coming out, I normally tell my patients not to worry about it. The amount of output depends on your activities, type of surgery, and the location of the surgery, and that can vary from day to day. In terms of common question is what happens if they can see a blood clot in the bulb or in the tube. So if it's in the bulb, it doesn't matter. It doesn't interfere with the suction function of the system. However, if it's in the tube, it's important to basically move the clot to the bulb. The way you do it, you basically pinch above the clot and just move your hand along the tube all the way to the bulb. And this way you move the clot to the bulb, and you basically, this is called the stripping or milking the tube. I'm gonna post another video at the end of this to show on a real patient how we can do that. I hope this answers your questions, and I will see you in the future videos. Thank you. You can start now.
It's running.
So we are gonna show you how to milk the drain. So you pinch the top part of the drain, and while pinching it, you just pull your hand along the way. Keep the bottom one pinched, and then let the top one go. And this way you run it all the way to the bulb. This way, if there is any clots or anything in the tube, it will dislodge it. I'm gonna do this side. As you can see, there is some clots moving down, so we go above it and continue doing that so the tube is clear. And we do this side as well. You can see there are some clots moving. Here we go. All right, okay.